what we think happens during aging, and was only recently discovered less than a few months ago, is that the important stem cells for hair regrowth get kicked out of the hair follicle. They get spat out, which was unexpected. We thought that they died, but they actually get expelled.
These get like shot out like a little cannon.
Right. And there's a video of this that I tweeted about at the time. And so what that means is that you want to prevent that from them getting expelled. But also you want to maintain their function as well, which is all about preserving their epigenome, their ability to remember the type of cell that they are. More externally, what we've known for since the 1960s is that the hair follicle shrinks and gets small, caused in part by dihydrotestosterone. And when that happens, the hair becomes thinner and thinner until it stops going through what's called the anagen phase, which is the hair growth phase, as opposed to the other three phases, which are called catagen, telogen, and exogen.
And this is really what like a lot of the treatments are aimed at preventing. Let's talk about some of those. There's topical treatments, there's pills, there's some other stuff, but let's start with topical treatments. These are creams that you rub on your head. Do these things work?
Oh, they undoubtedly work. This is minoxidil, also known as Rogaine. It was first discovered in the 1960s from a group that was trying to lower blood pressure. So what it does is it stimulates nitric oxide production. Nitric oxide is important in Viagra, opens up the blood vessels, and they put it into patients and they found that they got extra hair growth. And
these were patients who were dealing with high blood pressure, and their doctors prescribed them their stuff, and they came back the next week and they're like, "What did you do to me?"
Well, a few months later, some of them got new hair. And then in the 1980s, it was formulated with an oily substance called DMSO to get it through the skin layer in the scalp, and found that it actually does slow down hair loss, mostly at the back of the head, but also here, even though it's not recommended here, it does work if you apply it across the whole top like that.
Retin-A also works for promoting anagen?
Yeah, that's a little known fact. If you have some retinol cream, 0.5%, you can rub it on your skin to reduce wrinkles, but you can also rub it on the parts of your hair that are thinning out or you don't want to lose hair. And especially in combination with Rogaine or minoxidil, it works quite effectively to slow that aging process.
Yeah, there was a study that showed after a year, if you combine tretinoin, which is Retin-A, with a little bit of minoxidil, it resulted in regrowth in 66% of the people after a year. That's a good result. If you're trying to regrow hair, that's a really good result.
Yeah, it is. And
the problem with this stuff is you've got to apply it several times a day. A lot of people don't like the way it feels on their scalps.
Yeah, it's an oily substance. It doesn't look good, doesn't feel good. So most people stop doing that regularly. But there's an alternative that doctors are recommending, which is taking a pill. Propecia, also known as finasteride.
Propecia. This is a once-a-day pill that inhibits testosterone.
Well, more specifically, dihydrotestosterone,
DHT.
Which is DHT is converted by a 5-alpha reductase, an enzyme that's found throughout the body. Now, 5-dihydrotestosterone is important in the body. It reduces fat. It's good for the heart, good for the mind. It has some other downsides. It actually helps your prostate grow as you get older and you need to go to the bathroom. So the real question is, what are the best levels for optimal longevity? And actually, there was a study on that. There was a study of 3,690 men that found that the levels of that hormone were optimal if they were relatively low, but within a middle range of 9.8 to 15.8 nanomoles per liter. And those were the men that lived the longest.
Which is interesting that you're saying there's an optimal level, because there has been some studies also looking at, for instance, eunuchs who don't have really hardly any testosterone at all, at least not any that's being produced by their testes, and they tend to live a really, really long time. So I guess on the face of it, you might think like the less the better.
Well, yeah, the testes are doing more than putting out testosterone, obviously, and cutting off testicles probably is affecting a lot of things, including the brain.